I developed back pain again. I just, similar situation. All of a sudden, I felt that pop and, oh no, what's that? And the pain grew, and I rested, and it didn't get any better. And I waited for about 6 weeks, and I said, all right, we got a problem, but how do I get better? So,
Right.
it made me better.
Thanks, Doc.
So
Right.
yeah. So he said, all right, well, I'll put you on this medication, an anti-inflammatory. And then if that doesn't work, maybe we'll think about injections in the joint. Okay, well, it didn't get any better with the medication. And I said, let's do the injection.
Sure.
And he did it, and nothing happened. I was same pain, back on the couch.
Welcome to the CoachMD podcast. I'm Dr. Charles Glassman, bringing you 3 decades of experience as a physician and a coach. Join us as we navigate the maze of medical advice with real-life stories, empowering you to take charge of your health. In our That Happens segment, guests share transformative experiences, reminding us that we're all human and not just patients. So get ready for a journey into healthcare reimagined, where empowerment and discovery pave the way. Hey, I'm Dr. Charles, aka CoachMD. In my over 30 years of medical practice, I have made it my goal to help you create a strong mind, a healthy body, and an unshakable spirit. I'd like to welcome you to the CoachMD podcast. And as many of you know who have listened, my whole approach as a doctor in my years of practice was always to look at people not as patients, not as coming to me to take care of them, but as people with full lives, full bodies, whole lives that are much more than just the body. And I always had the idea that I wasn't put here as a doctor to take care of people, but to help try to empower individuals to have the tools to take care of themselves. And I really feel that's so vitally important. And the guests I have on my podcast are people who you may know, who just seem very familiar because they're regular people. They're not necessarily experts in a field, but you know what? They're experts in their life. And they've had conditions, they've had issues that they've had to learn how to navigate. And of course, that may have brought them to an interaction with a medical doctor or the healthcare, or healthcare, and they had to decide what they were going to do, whether they were going to listen to the doctor's advice, the so-called expert, or were they going to dig a little deeper. And I'm here to help navigate people through those issues, through those conditions, but not only dealing with the body, but also bringing into the equation our spiritual life and how our mind and our spirit combine with the body to give us whole, full lives that we can live to the potential. And today, my guest is a dear friend of mine and my wife's, Lisa. And Lisa has had an experience dealing with a condition and issues. And we had talked about it a few years ago. And I'm going to have Lisa share with you some of the beginnings of what she went through and what she was dealing with, and start talking about how she was able to overcome these issues, kind of despite the advice of doctors. So I'm so happy, Lisa, that you agreed to come on today and to help out your friend in launching his new podcast. And I'm just really excited to have you. So thanks a lot for agreeing to do this. And I'll let you discuss how this all started with what you're going to talk about.
Okay. Thank you, Charlie. Thank you for having me on. And I appreciate what you're doing, because there aren't too many that I know of, any doctors out there that are doing that deal with the whole person. And that hopefully that's a wave of the future that's coming, to just not do a body part, think about treat a body part, but the whole person. So yeah, my story, I always had back problems ever since, even when I was younger, and your back goes out and you go to the chiropractor, and ever since I was a teenager, And I just thought, oh, okay, well, I just have a bad back and that's just the way it's going to be. So on and off, I would have issues where I'd be down for the count and my back would go out. I'd go to the chiropractor and he'd fix me and take a few sessions and I'd be better. And then as I got older, about 6 years ago or so, it really got bad to the point where I had an episode where my back went out, and I was on the couch for months.
Wow.
And went to doctors, orthopedic doctors, and they're just like, well, you just have spinal stenosis and you have this and you have that, and shrugging their shoulders. Here's some medication. And I was seeing a chiropractor at that time, and I'll fix you, we'll get you back. And of course, it just became an issue where it was more often than not, I was having back issues. And then after being down for several months and losing hope that I was ever going to get better, after seeing the doctor and they couldn't help me, I saw a surgeon, a friend of the family. He had operated on my stepdad, and he saw me and he said, well, Lisa, your back's just plumb wore out and it can't hold you up any longer. So I'm going to fix you and I'm going to do surgery. And at that point, a lot of people were just freaking out, saying, don't do it. I said, I feel like I have no choice. I have to do this because it's either take this chance or just stay on the couch for the rest of my life, on and off. So I decided to go through with it, and I was very hopeful. And I just said, you know what? You're going to fix me. I believe in this surgery. So I had my lumbar spine fused, and was very hopeful I would get better. And after the surgery, the recovery, you do all that. And I did do better. I felt like, oh, well, he fixed me. Like I felt like my back was broken and now I had this structure holding it up. So my back, because it couldn't hold itself up, this was going to do it. I was going to be good. So I was I was limited. I had that, range of motion I had to give up, but I was okay with that because I thought, well, that's what, the price you have to pay. So I would say I was good for about 5 years, I mean, except for my limitations. I mean, I wasn't running marathons or hiking or doing anything, but I felt like I had quality of life. And then 5 years later, I developed back pain again. A similar situation. All of a sudden, I felt that pop and, oh no, what's that? And the pain grew and I rested and it did get me better. And I waited for about 6 weeks and I said, all right, we got a problem. Maybe something in my surgery is bad. Maybe a pin, I don't know, something like that. So I immediately reached out to my surgeon. I said, okay, let me start there. And he saw me, he did an MRI and he did x-rays and he said, well, I don't see anything, but what's common with people with your kind of lumbar fusion surgery is you can have sacroiliac joint issues, SI joint. And he said, because those joints are absorbing the shock absorbers for your spine is fused. So now it's got to filter out somewhere. So it's affecting that joint. Okay. But how do I get better? So,
right.
maybe better.
Thanks, Doc.
So
you're right.
Yeah. So he said, all right, well, I'll put you on this medication, an anti-inflammatory. And then if that doesn't work, maybe we'll think about injections in the joint. Okay, well, it didn't get any better with the medication. And I said, let's do the injection. Sure. And he did it and nothing happened. I was same pain, back on the couch. So he said, I can't help you. There's nothing I can do. And of course, I said, okay, now what do I do? And so he said, I think you see a physiatrist. Maybe he can help you. So we went that route. And he did his x-rays because he thought maybe it wasn't my SI joint, maybe it was my hip. Okay, fine. Then he said, no, it's not your hip. So maybe it's, I don't know, your psoas muscle. Maybe it's that.
Right.
So
It's got to be something physical, right? It's got to be
something physical.
Yeah.
Okay, it's that. Your psoas muscle. Because I had pain there, and I thought, okay, maybe it's that. And so he did, like a lot of deep tissue massage, and okay, you're going to make me better. Well, I was started in August. In October, I was still on the couch. So this was already, I had been down since May. So aside from my doctor visits, I was on the couch. I was basically like an invalid. I was grateful to be able to get in the shower by myself. And that was about it. I needed help getting dressed. It was the whole thing. So after that, the physiatrist said, well, I think he was starting to get annoyed. It was like, they can't help you, and they get frustrated. So it was almost like he was, okay, bye. I can't help you,
Yeah.
It's demoralizing for both of us,
Sure.
So then he said, okay, maybe physical therapy will work. All right. And so, of course, I went into his physical therapist, and it made me worse.
Yeah.
I felt worse. And then I was like, it was like despair, it was setting in, because and the C word, the chronic.
Yeah.
It's like, this is your life now.
Yeah.
And so that didn't help. And so I was reaching out to different people about the SI joint, and everywhere I went, all the Facebook groups, well, it's just the way it is. You're just going to have to manage it. Or maybe you can find someone who can put it back into place, and all of these different things I was trying. I even got a massage table so I could do exercises. It was just, I was trying everything, and nothing was helping. And then my daughter found a physical therapist who specialized in SI joint problems. So at this point, we're going into November, end of November.
Yeah.
And so I saw her, and I thought she was helping me. The first time, she was very gentle, and I said, okay. Just back up a second. She was my third therapist. I had seen another one that I had seen years ago for my pre-surgery back issues, and I thought maybe he'll help me. And of course, again, it got worse. So she was my last hope. And I went in, and I thought she made me feel a little better. Like, she just wasn't doing much. And I thought, okay, little did I realize that I wasn't making the connection, that there was a mind thing going on even at that point. I believed that she was telling me, and I believed that she could help me. So therefore, I started to feel better. Not a whole lot, but I felt something. So the second time when I saw her, we were talking, and she's just having a conversation with me, asking me questions. And she looked at me and she says, I have a book for you to read. I said, what? And she goes, it's called Healing Back Pain by Dr. John Sarno. And I'm thinking, right away, I'm going, who's this kooky guy? Am I going to have to join his Facebook group and pay him money every month so he can, give me all his wisdom or whatever? I was very upset, thinking, what, a book? No, come on. I'm paying you to help me.
Right.
So anyway, so I went home discouraged, and
I want you to talk about that in a second. I just want to interrupt for 1 minute because we're about the segue point of where I love that you're going. And a couple things that when you said how you had the feeling that you had a bad back. I've always had a bad back. That's the mentality that you grew up with, which is not dissimilar from so many people. And the way we feel about ourselves. And it's the same thing when we define ourselves, and we'll say, oh, I am a hypertensive, or I am a heart patient, or I am a diabetic. When you say that I am or I have, it takes possession of something. And so by having a bad back, or I'm a migraine sufferer or whatever, you are taking possession of that. You're defining, not you, but one is defining themselves as having that. And that kind of trudges along with us as we go forward. And so Lisa is like any other person who's having back pain. So in my practice, what I saw over the years was that someone would come in for back pain, and this is kind of how it would go. we do an x-ray, and especially if they're in their middle age, they're going to have arthritis in their back. Everyone does. 100% of people over the age of 50 have degenerative disc disease. And some of them, and many of them, have it at levels where people who are complaining of severe pain, they have the same. But so why is it causing pain in one person and not the other? So someone would come into my office complaining of back pain. Typically, we put them on an anti-inflammatory. They come back, said, oh, it helped for a few days. It's still there. Send them to a physical therapy. Not helping. Send to orthopedics. Okay, you know, orthopedic, this is an orthopedic surgeon, so most orthopedic surgeons are not really interested in the day-to-day, and with all due respect, I mean, we need orthopedic surgeons, and they'll be the first to tell you they don't like to deal with back pain. All right, so they like to do surgery to fix things that are fixable, but they know that back pain is not usually fixable. There are some back pains that are, but usually not with surgery. So they'll send the person back to either physical therapy or to a physiatrist like that Lisa went to do injections. So you'll be injected with cortisone, maybe 3 to 6 times a year. And by the end of a year, the Band-Aid helped for a little bit, then wore off. And after a year, you're kind of in the same place. The doctor will say, look, I can't do anything else for you. You're on your own. Or they'll say, or go to a chiropractor. And chiropractors actually have been shown to be very effective, because a lot of chiropractors are not just about fixing certain things in the back, but they do have some modalities sometimes that might help. But usually the chiropractor in this scenario is at the back end. So then you're left with, okay, what do I do, doc? And the initial doctor that Lisa went to said, I'll fix you. Okay, I'll fix you. Your back is degenerative. I'll fix you, and I'll fix the pain. So the doctor did a fusion. But if you think about it, we know that surgery for back pain, just back pain alone, is generally not good. It doesn't help, because you're introducing, when you cut open skin and you do surgery, you're introducing scar tissue, and scar tissue can form around nerves and muscle, and it could actually might help for a little bit of time. But then, as Lisa experienced, it's the same scenario. Where back pain surgery is effective in about 20% of people is when there is a clear-cut disc, for instance, that's exploded or that ruptured and is pressing on a nerve, and the pain is radiating down the leg, or there's a dropped foot or something like that. Then talk to a doctor. A doctor might be able to repair that. So similarly with osteoarthritis of the hip or knee or whatever, sometimes, you know, you need a surgeon to fix that. So, but what Lisa experienced is a doctor, with all due respect, I'm not getting on the doctor's case, but there are so many spinal surgeons around, and most spinal surgeons, that's their job, to do surgery. That's why they're a spinal surgeon, either a neurosurgeon doing back surgery, or an orthopedic spine surgeon. But the good ones know that when they, and I'm not, again, not saying that he wasn't a good doctor. I'm sure he genuinely felt he could help you, but common sense will tell me that something else is going on. And I want to let Lisa now talk about what she came upon. And I think that also, you know, some of our discussions prior to her being introduced to that book may have been along those lines as well. And because I thought, when Lisa told me about the book, I said, whoa, didn't I mention that to you? And I may not have, but I knew about John Sarno, and I'll say a little bit more about that after Lisa tells what she, what she found from that.
Mm-hmm. And I think also, thank you, Charlie. I think also when, you know, with this issue, with this mind-body issue, we're so, what I've observed just from myself and other people, we're so over medicalized that we're not going to trust a book, or, you know, even if someone tells you, I don't know how many people I've spoken to since this that I say, I have a book for you. I'll say that like, oh, they go, oh, I have that book. I should read it again. There's a lot of people like that. They just, because we're so trained to believe that the doctor has all the answers, and how could a book possibly help you? Or you're just, it's the system. And so I've noticed that, and some people just aren't ready to, like, and I wasn't, I didn't want it, but if you had spoken to me or someone had shared that with me before my surgery, I probably would have ignored it and said, well, talk to me after the surgery or whatever. So, and even when the therapist told me about the book, I was angry. I didn't want to read it. I was very upset. And I went on, it took me a couple of days to kind of process it. And I was so desperate at that point, because I knew at that point, I was almost 9 months down. And I hadn't even gone upstairs. My bedroom was upstairs. Wow. I had to move downstairs. So I haven't even walked up a flight of steps. Wow. So it was, it was
desperate.
Bad.
Yeah.
So I was very desperate. So I looked online did some research. Let me check this book out, and I looked at the reviews, and time after time, people were saying, I had this and this and this, and I'm better. I'm hiking. I'm running. I'm doing all of these things. And I said, well, I have nothing to lose, but about, I don't know, $12 and a few hours of my time. So I went ahead and ordered the book.
And I'll put the link in it, by the way. I'm just going to tell the listeners and the viewers on YouTube, I'll put it in the description in this pod for the podcast, a link to some of Dr. Sarno's books. You can go ahead, Lisa. Sorry about that.
Yeah. No. So I read it. I began to read it, and I don't know. I got halfway through the book, and I said, "This is me. This is me. This is me." He describes people that have these chronic pain issues, and it was crazy. I said, "Oh my gosh, you're." It's like this is all who I am. This is my personality type. Everything he was describing was what I was dealing with. And so when I got done with the book, just from reading the book, about half my pain was gone.
Wow.
And wow. My mind was blown. I couldn't believe it. It was almost surreal. I said, I haven't done anything. I wasn't even going at that point. And I remember telling the therapist, I said, well, if this book does what you say it does, you're going to lose me as a patient. Because it's okay. I want to help you. So I think I went back to her once, and that was it. I think I'd seen her for a total of 3 or 4 times, and that was it. So I started to apply what the book was saying and do that work. And then I looked back and started to, I don't know how much you want me to go into that.
Yeah, no, tell us a little bit about, and I just want to say something about how great that therapist was, because a true therapist, and like anything, even a psychotherapist, a really good one is going to give you the tools to let you go, to be free, not to have to keep coming back over every week after week after week, year after year after year. No, you need to get to a point where they can release you and set you free. So yeah, tell us a little bit, some of the things that from that book that you were able to implement to help you.
Well, one of the biggest things that jumped out at me was being a man pleaser. And that's one of my things. And, I guess I had always known that, that was, and, I'm very hard on myself and perfectionist and all those things. And I'm going, wow, you just described me to a T. It's like you got inside my head, and then I began to look back and I said, okay, if the reason for my pain is not a physiological thing, it's something going on in my mind. And how Sarno describes it,
and I'll do that in a I'll talk about the physiology.
Okay, you'll do that.
Yeah.
So basically I just look back and I remember the events, the first episode with my back before my surgery. And I remember how much pressure I was under. My mom had passed away. My stepdad was, in a nursing home, and he was I remember him saying to me, "Don't leave me. I leave me." And I just, I have that, like, the savior complex, like all the pressure was, and I was, I internalized it. I wasn't thinking about it. I mean, you feel the pressure, but then you just go on. And so I remember the day that my back went out, I was getting ready to go to see him at the nursing home for his birthday. And I felt a lot of pressure, and just feeling overwhelmed by all of it. I was really busy. I was doing other things. And, and I remember just getting up to get dressed, and I just went to put my leg in the pant, like, and I just had this horrific pain course through my back. I went down for the count. I couldn't even move.
Wow.
It was so bad. And that's what started it. And, so I look back, I said, okay, what was going on with me? It all makes sense now. It was like my brain was protecting me, like, you don't want to do this, it was sounding the alarm. And then the second time when my back went out for that very long period of time, it was the same type of thing. I was dealing with a lot of pressure, a lot of outside pressure, feeling like I had to perform and do things. I was overwhelmed. And I said, oh my gosh, both times it was the same mindset. And so I really thought about that. It was like, here I am on the couch. I have a lot of time to just think about what happened to me. And then, the spiritual aspect of it was, knowing what I know about God, and he says, worship no other gods before me, and it's like I was placing the opinions of men over him. And men are much more cruel taskmasters. The Lord is not a cruel taskmaster.
Right.
He's gracious and kind and loving.
Amen.
And it was like a moment where I just said, oh my goodness, I'm man pleasing. It's like a form of idolatry. It's like you're worried more about what men think of you, and where the Lord isn't doing that. He says, come unto me, all ye who are weary and heavy laden, and I'll give you rest. My burden is easy, my yoke is light. So that's what went through my mind. And I went, oh Lord, forgive me. I went through a time of repentance, and then it was like freedom.
Wow.
It was like blowing, like Sarno says, blowing the cover off a covert operation that's going on in your head. My brain was trying to protect me.
Love that. Yeah.
And so it was like an epiphany. And I went, and then just the layers started coming off. I had to do some work, and it's just incredible. So now I see the pain as a teacher, because pain is a teacher. And so I would say, I'm mostly pain-free. If I have issues or pain, I know what it is now. And I smile at it. It's kind of like, I look at it like when you're looking at like a brook and you see the leaves floating. It's like you acknowledge the leaves are there, but you let them pass you by. You let them go.
Yeah.
And so that's what it's like. It's like I acknowledge it. I don't freak out and go, maybe this time it's this. It's something physical. I have like an evidence sheet. Like you start to, it's going in that direction. I don't do that anymore. I don't say, oh, I'm having back pain, I can't come, because I don't do that. It's like, no, I'm having something. So what I do is I pull back and I go, okay, is there something I need to change? Or I just have to like take care of myself. I circle the wagons and I go, things stop the presses, stop everything. I cancel my appointments, all that. And I'm like, I just got to focus on me right now. And I'm going to do something that brings me joy. And if I have to reorient something or say no to whatever, it's like a matter of survival. And I'm okay with that. Like I used to feel guilty taking care of myself. Oh, who does that? But now I do. And it's like, I'm going to do, but it's like, I got to take care of myself.
Yeah.
I'm going to go do something fun, even for a half an hour. And it's amazing. The pain goes away.
Yeah, no, I love that. Yeah, I love that. Dr. Sarno he was a podiatrist. He was a professor of physical medicine and rehab at Rusk Institute, one of the major centers in New York City. And he was just like any other regular conventional doctor in physical medicine and rehab thought everything could be explained physiologically and or structurally or mechanically, until he started to look at his patients and realize that they, one after the other, keep coming back and back. And he started talking to them and realizing that there's something else going on. And he started doing research. And I really respect him. He's passed away now for, I think, about 5 years. He died
Yeah.
at 92,
Yeah.
I think. But very smart, very well recognized and respected doctor, until he started developing the contrarian approach. Then he
Yeah.
started being
Uh-huh.
demonized. And as we know,
Yes.
so many doctors are, when they buck the trend or they go against
Yes.
what the majority of the medical establishment feels, they get demonized and ostracized. And he was, but it doesn't matter, because so many people are finding him on their own. And it's great that
Yeah.
the practitioner that you went to was able to offer that to you. So that's great.
Yeah.
Really
Yeah.
great.
Yeah.
Yeah.
Yeah. I know you want to go into these pain clinics and take a bunch of Sarno books and go, be free, be free, be
Right, right,
free,
right,
because
right.
most
Yeah.
people, but it's like you said, the over medicalized, and then just getting out of that idea. Because I gave the book to someone recently. We're going to a new church, and the guy was like hunched over, and I was like,
Mm.
"You okay?" And he goes, "Yeah, I got a bad back." I said, "Oh yeah, what's wrong?" "I got a herniated disc. I got that." I'm like, "Oh, okay." So I have a book for you to read, and I gave it to them. I bought another one. I just gave it to them.
Right.
But they're kind of like looking at me, and I'm going, some people aren't ready. They
Mm-hmm.
don't trust it, and they're like, this is weird. And I'm a fusion surgery patient, and I have limitations in motion because of the
Mm-hmm.
fusion,
Sure.
but I lift heavy things. I was helping my husband Chris lift big fencing panels, stockade fencing,
Mm-hmm.
together, and he said they weigh around 80 or so. 80.
Wow.
And I'm doing that and trudging up the hill, and I got done, and I said, "Oh my gosh, here I am, almost 60, and I feel better now than I did when I was 50."
Oh, I
I felt
love
like
it.
a decrepit old woman
I
at
love
50. I
it.
said, "My life's over." So it's very freeing. God is good, and I'm
Yeah.
grateful for Dr. Sarno and for doctors like you that really look at the whole person, because it's just an amazing thing to know
Yeah.
that more people will be free
Yep.
of, chronic pain.
Mm. And
So
yeah, thank you so much for sharing that, Lisa. And chronic pain, because let's back up a little bit, and I'll kind of discuss what Lisa's saying. It almost sounds like it's a miracle, and you know, it kind of is a miracle, because it's a covert operation in our head that's going on all the time. And I wrote a book a number of years ago called Brain Drain, and then I wrote kind of another, not kind of, but another book after that, which I feel was an evolution of book Brain Drain, called Fake News Stories by Your Brain. And that's the covert operation. And I had not heard of John Sarno before I wrote my first book. And then I started learning about John Sarno from Howard Stern. He famously cured Howard Stern of his back pain, and John Stossel of his back pain, and a number of other celebrities of their back pain. And I started looking at his work, and I'm saying, wow, somebody is actually putting into motion the things that I wrote about. And what does that mean when Lisa says that she identified these kind of triggering events as causing her pain? So what's going on when nobody wants to hear, oh, it's all in your head? They want to know that it's a structural problem that can be fixed, that they don't have to do, one doesn't have to do anything about it themselves. And like I said at the onset, my role as a physician is not to take care of you, but to give you the tools to be able to take care of yourself, so you can become an expert in your own life. That's the key. So what's happening is that our brain, we have two brains, the way I look, well, really a brain and a mind. And the way I've written about it and the way I look at it is that we have a primitive nature, which is I call automatic brain. And that's our animal nature. And all animals in in the world have this primitive nature, which is run on the reptilian brain. It runs on the fight or flight. They're not thinking, they're just responding and reacting. Okay. Yet we have a higher mind, which I call our divine nature, which I believe is how God communicates with us and how we communicate with God, or if God isn't who you pray to or you believe in, something larger than yourself. We must acknowledge, and that's a discussion that we're going to get to in a minute, but there's something larger than ourselves, beyond the physical world, beyond our five senses. And that divine nature is really allows us to take a step back and to look at what's going on. So this automatic primitive brain only responds to danger, threat, or vulnerability. And if your five senses survey the landscape and there's a sign that there's danger, that or there's a threat, or that you're feeling vulnerable, it will fire. And how does it fire? It's a biochemical reaction that causes you to fight or flee. And what happens when you fight or flee? That sends a message to your body that your body must get ready to fight, get ready to flee. And the way you do that is your muscles contract. And when your muscles contract, it decreases blood flow to some of those muscles. It increases blood flow to major organs, but it can decrease blood flow. And what John Sarno is saying, the origin of the pain that you feel is he's defined as tension myositis syndrome, or TMS. And that TMS is due to a microscopic oxygen deprivation to the muscle. So the pain you're actually feeling, and you're told is skeletal, is actually coming from a slight decrease, a very slight decrease in the oxygen to the muscle. So the nerve is picking that up and sending a signal to the brain, because how do you feel pain? You feel pain, your brain interprets the pain, and the pain is a signal that there's danger. So it signals more fight or flight. So it becomes a vicious cycle. If you want to understand how that signal of pain takes time to reach the brain, how about when you stub your toe? When you stub your toe, you know it's coming. You know that pain's coming. It takes a second or so, and then you feel it. It's the same thing when you're feeling that pain in the back, let's say, but it becomes a vicious cycle. And Lisa was stuck in a vicious cycle until she allowed her higher mind, her divine nature, to take a step back, to look at her body in a more spiritual way almost, and going by some of the recommendations that John Sarno set forth, and a different way to view it. Now, are we saying that all of this can be solved by John Sarno? No, but a great deal can. And if you're suffering from back pain like Lisa was suffering from, and she's told you how it helped her, you might want to consider that it may take some work. It will take some work, but you have to trust that you have the tools and the capability of understanding just how your brain is interpreting danger, threat, or vulnerability. In Lisa's case, the danger and threat was what authorities were telling her. And to go against that would put her in a lesser position. So what does she do? She fights or flees. She flees mainly, withdraws, tightens up, tenses up, causes decreased oxygen to get to the muscle. That signals the pain to the brain, and she gets stuck, but she got unstuck. Yeah, that's great, Lisa. Thank you so much for being so, so willing to share your story. It's really, I know it's going to help a lot of people out there.
Yes, you're happy to help.
Yeah.
Really, I mean, it's not fun. I would say it was probably the worst thing I've ever gone through personally, to get to the point where, I didn't want to be here anymore. I just said, this isn't life. There's no quality of life. When I started envying people who had terminal illness, saying, well, at least it's going to end for them.
Wow.
That's how bad it got.
Wow.
With my back surgery, it wasn't like that. But this, 9 months. Yeah, it was really rough.
Yeah.
So, but I like how you said that, like the perceived danger, because I think that's exactly what was going on. Because I know Sarno talks about anger, repressed anger, and I get all that, but what you said was really, I believe what was happening with me more so, that feeling of being trapped. And
Mm-hmm.
so because I'm a man pleaser, I can't just say no.
Mm-hmm.
God forbid
Yeah,
say
it's
no. Well,
dangerous.
that would be, yeah. So it was like, okay, bye-bye. I'm checking out. Down I
Mm-hmm.
go,
Yeah.
And I didn't know that. If you told me that, it was a no, but
Yeah.
just amazing.
Yeah, and the anger, anger is a fight response. So that can be one of them. I agree with you. I don't think that's the only one. And this is, what Lisa's saying does not now John Sarno in his book says that, you shouldn't go to physical therapy, you shouldn't go to chiropractic because you're focusing on the body part of it and you're not focusing enough on the emotional. And I agree to that to some extent, but for someone who works out a lot and who feels really good and strong when I work out, I know that there are exercises that you can do and fitness that you can do that can greatly help that tension myositis syndrome, and that could increase the circulation of blood to the muscles. And certainly what he does encourage that. Okay, he does say that most people who have back pain will say, "Oh no, I can't run again, or I can't work out again," or I know that probably what you were feeling. He says, "No, just go do it and overcome that." And there are certain exercises which on other podcasts I'll go over that will talk about that sort of thing. But I really wanted today to talk to Lisa about this aspect of her health and her physical, and how the physical was kind of getting into the mind and the spirit part of her life. And that's, what I want to segue now into talking about in this part of the podcast, because uh, I describe these events that happen in our life as that happened. And there are certain things that happen in our life that we can't explain. If you run the odds, or you run the logic, or the probability of things happening in our lives that help shape our lives in our faith and our belief and our trust in something greater than ourselves. And I've said it, that my trust and belief and faith is to a higher power, and of my faith, it's to the God of Abraham, Isaac, and Jacob. But that, it doesn't have to be what you believe, but what I'm saying is that there is something greater than our five senses. And when these things happen, it helps reassure us and ground us in that. And Lisa was saying how she got to a point where she realized that she wasn't trusting enough in that part of her. And I want to start talking about with Lisa maybe something that happened in her life during this, before this, after this, that might have been really influential in further locking it down. And I'm just going to share with you also something, and I have a lot of these because I used to call it daily magic, and I kept a journal. And I would encourage people, if something happens that you can't explain in your life, that happened. Whoa, that happened. Well, write it down, because I guarantee you will forget it. But I don't forget a lot of them because I write them down. And I'm just going to pick one because they happen to me a lot. And this was just some random Wednesday, and I was, and the skies didn't open. It wasn't some, crazy thing, but I came home, I drove into my garage, opened up the garage, let the automatic garage door close the garage, went about my day, and I had to be out at a meeting at 6:30 that night. So at 6:15 that night, I went out to the garage and I hit the automatic door opener. Didn't go up. I couldn't understand maybe it's broken. So I go to the door to try to lift it up. I'm lifting it up and it's clanking. And I'm thinking, oh my goodness, it's broken. The mechanism must have broken. But then I went to the door and I saw that there's a metal latch that you can manually slide across to lock it manually. And that was slid all the way closed, locked. Now, nobody had been in and out of that garage except for me, and it opened easily, closed easily. It wasn't loose, so it couldn't have slid all the way closed. And so I unlocked it, let it go, was a little bit late for my meeting. No big deal, right? So I take a back step and I say, well, how did that happen? I mean, that happened. How did it happen? What's the probability of somehow that latch was slid all the way through? And I asked everyone in my household, nobody was playing a practical joke. Now, again, I don't know what that meant. The skies didn't open. The Lord didn't reach down upon me and say, I saved you, whatever, but maybe there was something. Maybe if I was on that road where I was going to that meeting a minute earlier, maybe something was going to cross my path and it would have been not so good. So that's the kind of thing that happens in our lives that I say, well, something's going on. I can't explain it. But when you start adding those up, they start really forming a foundation of something in our lives that we can't explain. I'm just going to take a drink. And this is not a shameless plug for what I'm drinking, but I will put in the link some of the things that I mix up every afternoon, which a little bit of collagen, a little bit of matcha also, curcumin, turmeric. I put some other stuff in it. It's a good mix, and I'll put that link in the description too. But it does keep me going for the afternoon. But anyway, Lisa, I'd like you to share if there's anything that you could say that where you just look back and you say, wow, that really happened.
Mm-hmm. Well, I think what I was talking about before, just the fact that I had to go through a really painful trial in order to realize, I mean, for most of my life, almost all of my life, I was operating under that fear of man and wanting to please people. And that happened. I mean, I had it because if I was only down for maybe a month or two and I read the book and I said, oh, this is great. I would have said, well, hey, I got out of pain. Like, yeah, that's good. But it had to last as long as it did to really get my attention, to make me despair of life. Like it was serious. This was a lesson that I believe that the Lord had to teach me, and it had to last that long for me to really see the destructive nature of what being a people pleaser is, how destructive it is. And I think that was a lesson, lifelong. I will never forget. I live differently now. My life is not the same. I mean, my life is not the same because I have a very strong faith in Jesus. I know that was the event in my life, the most important event. But this, I would say, really, really taught me the seriousness of living a life that's operating in the fear of man. And like you said, you don't want to say no, so you'd rather, take a gunshot or something.
Right.
It's like you get to that
Literally,
point where you want to you'd rather be in pain than, oh no, the horror of saying no and letting somebody down. And it's just the layers of that. It was just such a lifelong, I'll never be the same. It's taught me also, obviously, it's like that happened. Yeah, that was a thing. And I don't regret it. I'm grateful for it. And I'm even grateful sometimes where I'll have like a little flare up. It's like, okay, what's this teaching me? It's not just pain I need to get out of. What's going on? Am I starting to slip back into those old ways? So it's like a gift, and people that so I would say that was the mercy of God. I had to go through a really bad trial, but we're stubborn. We humans, we're very stubborn.
I have to ask you, how did you find that therapist? The one who?
Oh, okay. So my older daughter, Lindsay, I was telling her, I said, I need to find somebody who specializes in SI joint, and I can't find anybody. And she, being the quintessential researcher, the Lord used her, and she said, Mom, I found somebody. They're right in the county. I said, really? She said, yeah, call her. So I did, and the rest is history. I got the appointment. So Lindsay found her.
So
My daughter
okay. So that happened, obviously all of what happened to you was, we know was something greater, but the fact that she found, out of all therapists, the one therapist who recommended, who had that in her toolbox to recommend that to you. I think of all the therapists, I mean, that she picked out, that, I'm sure there are some, but I haven't met too many who recommend that book to people. So, I think that is really special. And as you said, the Lord was looking after you, and I don't disagree with that at all. And I think it was through your daughter and through that therapist. And of all the therapists that she could have picked and found, that's the one that came to. And and I think that as you said, it solidifies a lot and has changed your life, which is amazing.
Yeah. And I'm very grateful. I keep in touch with her. I've emailed her. I haven't gotten to see her. It was kind of during the COVID thing. So and so
but you'll tell her about the podcast. Like. So
I know her eyes. So I know that. But she said to me, I have 4 herniated discs. I'm fine.
Wow.
Tiny little thing popping around, and I go, wait, what? You have 4?
Yeah.
She said, yep, and I'm fine. She said, I have no pain. So she was a real, just an amazing woman,
Wow.
Really a wonderful Orthodox Jewish woman.
Wow.
And and just, she's tiny little thing, but strong, very strong.
Wow. That's beautiful. Yeah. See, the back.
She pegged me.
I'm sorry?
She had me pegged. She figured me out second time. Right. Like, I see you. I know what's going on.
Right. Yeah, that's very special. Wow. The back is different from any other joint, and it's not something that's easily fixed. So you really have to, and it's lined by muscles. It's really, we don't think about it, but everybody thinks about the core as the 6-pack, right? I want to get a strong core. I want to get a 6-pack. No, the biggest core that we don't realize are the gluteal muscles. That's our butt muscles, right? And the back, of course, the abdominal muscles. Yeah, but the back to hold us erect. As we get older, gravity kind of leans us forward, but the back brings us backward and straight and erect. And that's not easy to maintain. And especially when you're having doctors do surgery on you and saying they could fix you. Unfortunately, look before you have surgery for back pain, think long and hard about it and listen to the podcast, what Lisa's saying. And Lisa, I can tell you, is a straight shooter, beautiful, wonderful person you are, Lisa. And I know that this is going to help a lot of people, really. So
I think about it. It's like, I didn't need that surgery. I didn't need that. That's what that was. But it is what it is.
Right.
I can't look back.
You needed it for other reasons. Not
exactly. Exactly. In my head, I'm like, and that's the power of the mind. I just believed it, and therefore, So it's all okay.
That's wonderful. Yeah. So anything else you want to share with us before we wrap things up?
No, just grateful, like I said, for people like yourself that really wants to look into the whole person. I think it's sad that people don't have that, and we're in this whole big realm of chronic pain, which doesn't have to be, but there are bright spots like yourself, and my physical therapist who really, they see, you
Yeah.
see, and I think it's great. It's going to be really helpful to people what you're doing.
Yeah.
So
Yeah. Well, we hope it is. And, what I want to say to the listener is that you're listening to Lisa and you're saying, "Oh, it's good for her, but it's not me. I'm just a wreck. I can't do that. It's not. There's nothing in my life." And Lisa was feeling that way. That she like wasn't going to read the book at all. She wasn't going to consider anything other than the physical. But when you're in chronic pain, try not to look to the doctors necessarily for your answers. You really have to be your own advocate, because you're an expert on yourself. The doctors are really not an expert in you. They don't know your life. They don't know your daily life. They don't know your trials and tribulations. They don't know your emotional history, your family history. Really, I mean, we take a very quick cursory family history. And I heard of this woman who was in chronic back pain, and she was going for a spinal cord stimulator. And before you get a spinal cord stimulator, and a spinal cord stimulator is trying to fake the message to the brain. So it stimulates the spinal nerves. So it sends a signal to override the pain sensation. But before you get a spinal stimulator, you have to have a psychiatric or an exam by a psychologist. And I read the psychology. She told me about the psychology report, and she brought it to me to read it. And there was nothing about the fact that she was raped at 12 years old, and she lost her first child about 1 year before her back pain started. Now, come on. I mean, this is all physical. There's nothing that you need to consider emotionally. Not one doctor, when she was in my office, we went over this, and there was not one doctor who brought that up in any of the records. And so you need to consider really strongly when you're going to your doctor for relief, for help, for medication, shooting your body with cortisone, doing when they talk about giving your injections, those are Band-Aids, and shooting cortisone into your body is not good for you. So anyway, this is one other thing to consider strongly. And if you have any questions, please feel free to leave them in the message, and let me know what you think about this. Certainly subscribe to the podcast and support this so we can keep doing more of these kind of presentations. And again, Lisa, thank you so much for bearing your soul to us and sharing these intimate details of your life. I really appreciate that.
Thank you. You're happy to do it. Thank you, Charlie. I appreciate you having me on.
Yeah, and I can't wait to get together on a personal level soon. So
yes,
we'll do that. So
okay.
until next time, I'm Dr. Charles, aka CoachMD, urging you to stay strong in mind, in body, and most importantly, in soul. Bye for now.